The Heart Center at Nationwide Children's is dedicated to the unique needs of its patients. If your baby's heart has an atrioventricular or AV septal defect, your doctor may recommend a procedure to repair it. The goals of an AV septal defect repair are to close the hole between the chambers of your child's heart and repair the valves. This will prevent future damage to your child's lungs. Most children will have this procedure before they're 6 months old. Inside the heart, a complete AV septal defect is a hole in the wall that normally separates the right and left atria and right and left ventricles. And there is a single valve that spans the defect instead of 2 separate normal valves. An AV septal repair is open heart surgery, so your child will be placed on a heart-lung bypass machine. To begin, the surgeon will make an incision in the chest. Once the heart is reached and your child is safely on cardiopulmonary bypass, the surgeon will make an incision in the baby's right atrium. The hole will be closed with either 1 or 2 patches. If 2 patches are used, the first patch will close the hole between the right and left ventricles. Then, a second patch will be used to close the hole between the right and left atria. If a single patch is used, the surgeon will use it to close both the hole between the ventricles and the hole between the atria. With either 1 or 2 patches, the single valve between the atria and ventricles is separated into a right AV valve and a left AV valve. At the end of the procedure, the surgeon will close the incision in the right atrium with sutures, and the chest incision will be closed and covered with sterile dressings. Every patient is unique. Our Heart Center team at Nationwide Children's has the experience to support you and your child through the entire journey. We are available to answer all of your questions at any time at 614-722-2530 and at nationwidechildrens.org/heart.